Welcome to Get Moving TV. I'm Dr. Chris Landon, and I serve as your host. I'm very proud of the women in our county, and we're really going to be featuring some outstanding young people and people who have chosen careers of helping us, but have chosen careers other than being a mother at home. We're going to have them talk a little bit about their mothers too, because when you see a football touchdown being made, nobody's thanking dad, the guy who's out there throwing the ball all the time. It's always mom, and there's a reason for that. With me today is Caitlin. So Caitlin, how did I get to know about you?
Well, you actually got to know me through my mother, who's a very active person in the community.
Strangely enough, a mother is very proud of you and proud of her involvement with you, and you're wearing Girl Scouts
yes.
today. So did your mom get you started in brownies and all that? So.
Yes, I have an older sister, and she got involved in Girl Scouts before I was born. And then as I grew up, I felt very passionate about Girl Scouts and wanted to experience it also. And so my mother got me into Girl Scouts and is now my Girl Scout leader. But she didn't start that way, but now she is.
And you didn't have to wear hand-me-downs from your...
I actually did.
I
did
so, yeah.
do that quite a lot.
That's just how it goes. So I see we have some badges there for economics. And so how did you do with sewing?
I was not the best at sewing.
So not the future career for you in sewing?
Definitely not.
What have we've got cooking over there somewhere?
Also not one of my best suited things.
What else we got? Budgeting.
Yes.
And technology.
Yeah.
Technology?
Yes.
Really? Girl Scouts? Technology? What's that all about?
People don't actually think of Girl Scouts, they think of cookies, but cookies and all those things take budgeting and money management, which also goes hand in hand with technology, and that's something that I'm very passionate about, the STEM educational field, which Girl Scouts has actually helped me a lot to experience.
Well, STEM, I see radish stems on there somewhere. What does STEM stand for? STEM
is science, technology, engineering, and math. And generally, people think of it as a manly-based field, but it's actually becoming very prevalent in women. And women are inventing and going into the STEM fields.
Well, that's my daughter is a civil engineer. Anything but being a doctor after hearing diaper rash calls all night for however long. And she cautioned me, and it's a caution I've spread on to all my young women, and that is, at 13, boys, suddenly you don't want to know math, and you guys are stars. So
right.
Not to let that fall away. It's not a manly thing. It's all about your brain and what yes. you end up doing with it. That's the most important.
Oh, definitely.
So I see some little play toys here. So how have you put this science, technology, engineering to work?
Well, I've always been very interested in science and technology, and especially math. And so as I've gotten into high school, I've taken the honors and AP courses that are available at my high school. And as a junior, I got involved this year with my robotics team, 3925 Robo Circuits. And we have become a very active robotics team, and so that has helped me get into the STEM fields and explored different parts of the field. Here is different robots that are geared to the child, so girls and boys that are excited about the STEM field and learning about technology. These are actually geared to younger students, elementary to beginning of middle school, so they can get into that STEM field early.
I see a paper airplane.
Yes, paper airplanes they seem very simple, but they take a lot of spatial and mathematical skills, folding the paper just right to get the aerodynamics perfectly to soar, not just fall to the ground.
Sounds like you've been watching my paper airplanes. So yeah, do you have competitions? Is this where they come in with giant things and destroy each other? Or what's a robot competition like?
Right.
What kinds of things would I see at a robot competition?
That is a great question. We actually hosted the first Ventura County Regional Robotics Competition here at Ventura College. Our team, along with a couple other community teams, hosted the event. And it consisted of 45 different robotics teams all over Southern California coming together and competing for one winning spot, an alliance team. And this year's competition idea was Recycle Rush, which is really great because it's environmentally conscious, spreading the word of environmental consciousness. And we had to stack plastic totes using our robot and then put a recycling bin on top of it, which was very interesting because this year's competition was very mechanical build team heavy. We had a lot of engineering and different problems, but the competition itself is not difficult, but the building of the robot was very complicated.
Let's see, would have been a while back, maybe 1968 or so. I was in charge of, I got about 18 inches at the Stanford Artificial Intelligence Center trying to get a robot to move forward, and then they had this speed bump and I couldn't figure out how to do that. I think things are a little different. In my day, the floor, you picked it up with special suction cups, and if the things weren't working, it's because there was a real bug in the wires.
Right.
So now it's more software bugs, I think, than real bugs.
We actually had a very big software issue at our competition where our robot got a big glitch and the back wheels were working and the front wheels weren't. So we kept falling over, and that took a lot of different team members, both on electrical and software team, to figure that out.
So where does this, are you teaching younger people then? Because we really want you to be role models. We want my young women to go, ooh, I guess I should know math, even boys will still like me, or whatever it is that's important.
Right. Yes, actually, as a Girl Scout, we are offered the opportunity to do a Girl Scout Gold Award project, in which we're encouraged to step out of our little bubble and help the community around us. And I took that very seriously, and I am currently working on my Girl Scout Gold Award, in which I am working with the Boys and Girls Club, also Girl Scout troops, and community departments around the county, and I go and I teach them spatial awareness and STEM educational fields and coding, things with electrical team, all that sort of things on a more basic level for elementary school kids, so they get that feeling of excitement about building and accomplishing things at an early age, in which they want to be able to do that further when they're older.
Well, we could use you at my clinic. We have 10 iPads that were donated by Hope's Haven. Thank you, Hope's Haven, which we use for our kids as they're waiting. And so we're looking for the right games to put on there, that not everything can be Minions Rush, and that there's enough education in there. And we're hoping to hook up with Foothill Technology High School students, but you would certainly be welcome to come up and have some fun with us there.
I would love that.
So where do you go from here? You're a junior in high school?
Yes, I'm currently a junior student at Ventura High School, and I'm looking into the application period of my life, so looking to apply to California schools, out-of-state schools, things like that. And I actually did just do a bunch of college tours and research the STEM fields, and I'm currently looking into specifically biomedical engineering, or the biological sciences.
Okay, so where are you looking at biomedical engineering?
I looked at quite a few different schools. It's not a super prevalent major, but it's actually coming into great play because the medical field, and specifically, needs the engineers in the technology, so the different processes, the machines that keep people alive, the dialysis machines, all those sort of things. They need people who can come up with better and more efficient ways to run those.
Well, Caitlin, so thank you so much for joining us today.
Yeah.
And we will look forward, of course, to you becoming a famous biomedical engineer. And Ventura, we're going to be right back. We're proud of our young women. Ventura, welcome back. I'm here with Audrey. Audrey, with women, sometimes you go through a myriad of careers before you end up doing something. And we met Tuesday morning at 8:30. First we interviewed you, and what career did you end up with?
Well, I'm a respiratory therapist with the County of Ventura Healthcare Agency, ambulatory care.
And so I met you as part of a project. What project had you interviewed for?
Our project is CATCH, and that stands for COPD Access to Community Health.
Well, that sounds like a good thing. So it's for the whole county of Ventura. It's not just the healthcare agencies, really, to help everyone in the county.
The whole county, even Westlake.
Well, how many people do we think are affected? I mean, does it kill people in Ventura County? It's just COPD. I mean, people smoke and they cough and.
Yes, it's ranked the third largest cause of death in the county, behind cancer and heart disease.
Wow, so it's not just all about radioactive bombs and Ebola, and it sounds like it's a pretty big health problem.
It is a big health problem.
In terms of, we've had all these taxes on cigarettes and what used to be 50 cents a pack and was $1 a pack. I don't know what a pack costs nowadays. People can still afford to smoke at all?
Well, it's highly addictive, and that's part of the problem.
So are there assets? So as a respiratory therapist, you're not really to run ventilators, but what kind of things do you do in this program?
Yeah, in my outpatient position, I work with first identifying COPD patients across the county. So we do a lot of outreach. We do a lot of work with hospitals, clinics, senior centers, the VA, et cetera, and we go to their homes and we determine if they're eligible for the program. It is a grant, and it's no cost to Medicare and Medi-Cal patients. The idea is to reduce hospital readmissions of COPD. They can exacerbate quite easily, just based on the lung disease itself. It's very easy to become very breathless, short of breath, have a lot of secretions in their lungs, which can cause a lot of problems.
Well, I know in my practice I take care of a lot of children, and all those children have parents, and those parents have grandparents, and they are worried about grandma and grandpa are still smoking and coughing and doing less, and they're just not going to be around to watch their grandchildren grow up. So are there resources to stop smoking in this county?
There is. We have 1-800-NO-BUTS is the California program, and we have Call It Quits, and that's the County of Ventura program. And I believe they're both free of charge. I know the county program is free of charge.
I understand they can get patches and gums and pills, and I understand there's a gift card too. So
there's a $20 gift card if you remain smoke-free for 6 months.
So that's really important. And for a hospital now, the hospital discharge does not end when they leave the hospital. And that's really what this program is all about. It's the 30 days after, when most of the patients, if they're going to come back, are coming back. And we're going to talk later with another guest about pulmonary rehabilitation and habilitation. And really, and I'm hoping that these sons and daughters of these people can really help them with activities of daily living and getting outside and getting in the park. We hear so many sad stories at our Tuesday morning meetings of people making it from the bed to the chair to sit next to their husband, and they're 55 years old, and that's really all they've got. So,
right. Well, a lot of attention hasn't been placed on this disease, and so I'm hoping that, and I feel really a lot of optimism toward the ability to assist these patients just in the quality of their life, improving that. There's no cure, so we can do that, and we can make their lives easier and keep them out of the hospital.
Well, certainly there's medication.
Yes.
And so part of what we see is just a lack of adherence to the medication, just remembering to take it there 1 or 2 or 3 or 4 times a day, or there's simpler medications but with more side effects, or they forget to come to their appointments, or they have coexistent comorbid diseases. So can they, through the case managers there, do they get access to all the services that they need? You guys will help them with remembering appointments and refills, and
yes,
so even there's diabetologists and
keeping their medications, on track, and yes, absolutely reminders, because that is part of the problem. The not doing it. Also, as simple as breathing exercises, that can help a lot too.
Thank you so much for joining us today and talking a little bit about the CATCH program. Ventura, we're going to be right back. Welcome back, Ventura. Well, I'm here with Amy Towner, and I met Amy when she was a mom and a National Charity League junior, and
that's right.
All excited about fundraising. And so, how's your journey today? What is it that you're doing for us now?
Well, today, thank you for asking, and thank you for having me today, Dr. Landon. Leadership has asked for us to have, for the healthcare agency to have its own foundation. Mm-hmm. So recently in December, the healthcare agency has established, or the healthcare foundation has been established mm-hmm. To serve healthcare agency and Ventura County Medical Center and Santa Paula Hospital and all of its different divisions. So we're excited to announce that Healthcare Foundation for Ventura County is officially open for business.
Well, welcome.
Thank you.
On my side of the building, we have the 5-story ambulatory care building that I drew out on a piece of paper in 1995, and we moved in 3 years ago. And because I'm the boss, I get to decide where in the building I am, and we look out on the Bob the Builder show. Mm-hmm. What's being built there behind Ventura County Medical Center?
Thank you for asking. The hospital replacement wing. The hospital is undergoing a $350 million hospital replacement wing project for our inpatient care, and we're really looking forward to having that complete in spring of 2017.
Well, I know there are some special things where they have to bring in workers from outside of our county, mm-hmm. but I think, of course, they all end up living here and having to spend money in our county. So it's really an investment in our community just from a monetary and job standpoint. But what kinds of things, how is it bringing increased level of care to Ventura County? And we'll talk about the kinds of things, how the foundation is going to support that increased level of care.
Absolutely. Thank you for mentioning that as well. That's definitely, it's going to be wonderful to have, all of the rooms will be inpatient private rooms. So yes, all of our care will be specialized, and we'll have a dedicated women's and children's floor, PICU, NICU, women's and children's floor. We'll have a hybrid OR, which is very exciting, down below, and a lobby with a concierge desk and an open air plaza, which will be nice as well. So yes.
Well, really a place to heal. I think there's healing gardens there. It's been designed not just as a block wall, and it also supports the trauma service. I mean, we are the trauma service for this part of the county. Absolutely,
a campus of healing. A campus of healing.
So what kinds of things? So as a healthcare foundation, you're looking for, well, anything we can do to reduce the cost. So if someone can donate a bed in their name, are you starting to name things yet, or that's a little bit in the future?
It's a little bit in the future right now, but absolutely, yes, we definitely want to be engaging the public on that and our community. By all means, yes, we want to be able to do that, and the foundation is set up to actually augment our county dollars. So the county is, our system, actually a lot of people don't realize this, but we are set up as an enterprise system, which means that we're really operating more like a nonprofit. So we're self-sustaining through our own contributions primarily. So the foundation will be what takes what we do really good and makes it well and terrific. So we're really excited about that. So our foundation is really designed to augment that county dollar and to increase the level of, that level, make everything extra nice.
I know as you're starting out as a foundation, all these things cost money, and mm-hmm. I've been devoted to Ventura adult community education for a long time. We behind the cameras here are students who are going to graduate to work at lynda.com or wherever they're going to go. We have back office people who've come through our office. We support Foothill Technology High School as well, which is associated. Have you been able to use any of the graduates from this program or do internships with any of the people from this program?
Yes, actually we have. We're really excited to partner with Ventura Adult Continuing Education. The foundation, it needs help, of course, processing gifts, a lot of office administration. Ventura Adult Continuing Education has been able to provide us with interns that come and help us. We're a small business within a big business because we are a nonprofit, and they have been able to gain the work experience so that they can work in a healthcare environment, work in a small business. They'll have hands-on approach to all the different aspects of running a small business, and then hopefully having a gateway to be able to have the opportunity to interview and hopefully become a part of our healthcare agency family. That would be, that's hopefully the idea.
Well, who's on your board?
Yes. We have 3 board members. We have Harold Edwards, CEO of Limoneira. We have retired County Counsel Noel Claybaum, and we have Dr. Stuart Siegel from Children's Hospital Los Angeles, who's been an advocate for our system for over 40 years, serving the children in our county with cancer and blood diseases, and actually you've worked with him as well.
So what kinds of things do they see that we need? You don't have a social board, you don't have 20 or 30 people, you really have people who have a business in mind.
Right, right. We're looking forward to getting the strategic plan of the healthcare agency and being able to implement what the wants and needs of our agency is. Once they identify those things, and we are compiling that list as we speak, actually, and it's nice to be able to allow our government and our county system to be able to dream more than they've ever been able to dream, because the foundation will allow them to do that. So again, it takes from doing what we're doing that's really good and taking it to great.
We've done, with this pediatrics, it's kind of easy for us sometimes to bring people into donating and so forth.
Right.
So thank you, Uncle Fred, for donating for the last 20 years for our Christmas for all of our children. We have Camp Dream Street, we have Make-A-Wish, and we have a Build-A-Bear, and all the things that are associated with the county or with our pediatric services. What kinds of things for mothers? So if I'm a mother in this county, are there activities that they can get involved in terms of preparing for their birth, or their tours? And
well, absolutely. Anytime anyone wants to have a tour, by all means, please call the foundation, and we give tours many times a week. So tours are definitely there. Other things for mothers are going to be, we're actually engaging with Ronald McDonald House Charities, and we're going to have a Ronald McDonald House family room on our campus, which will be nice, and that's going to be upcoming. Lots of different opportunities. So
tell me a little bit more, because the Ronald McDonald House, they don't, it's not an easy thing to get on their radar.
No.
I know they've talked about maybe putting a home on the campus or doing the room. Tell us a little bit about the room and what's going to be what potentially that in 2017, is that the idea, is to put that room into the hospital?
Right, right. So Ronald McDonald House Charities of Southern California and with the sponsorship of the LA chapter have decided that they want to partner with us and put a family room concept on our campus. To our knowledge, this will be the first time that they have partnered with a public hospital, and will be the third family room in the state of California, so we're really excited about that. The family room is basically a respite for our families that, especially like NICU moms and dads, they're there for an extended period of time. And these are hardships on the family. Children with cancer who are undergoing treatment, their families are many times, taken away from each other because one parent is in the hospital with a child, the other one's working. This gives them that space, that respite that they need in order to keep the family unit whole, which is, of course, a better quality of care.
Well, and it's the simplest things. It's just taking a shower, or eating a meal, or just having a place that you can just get away from things. We've worked with Andre Sobel, River of Life, where this very wealthy mother saw that this poor mom had to go work. The Teddy Bear Cancer Foundation we've worked with, as you know, with Nikki Katz, and just allowing people to have that time and to not have to work, to be able to have someone pay their rent or pay their utilities or pay for some shoes. But you've got a bigger project ahead of you. So what are some of the things, I know you're walking someone around who, I made a little video of the hospital I wanted to build, and she sent me one of her, I forget, 55-story children's hospital back in Chicago. So if I'm a big donor, how do I get a hold of you?
Oh, well, www.hcfvc.org, Amy Towner, 652-3361, that's area code 805, or you can always email me at atowner@hcfvc.org.
And we'll play this right underneath you and at the end, because we really want to have that. So Yeah, in terms of this county, a lot of it is agriculture. When the largest employer in Ventura County, I think, is Ventura County itself in terms of sheriff and fire and so forth. And then we have Amgen here, but also the agriculture plays a big part as well. And you have the Edwards family.
Yes. Yes. And Dr. Sam Edwards, of course, was one of our doctors long ago. So Harold has a very much a kindred spirit with the healthcare agency and its legacy, us being here over 126 years serving Ventura County, regardless of people's ability to be able to pay. That's one of our specialties, of course, is accessing people with barriers to access.
And I know we have some of the finest physicians. We see children in my clinic, regardless of their ability to pay. I can have a lawyer sitting next to someone who's homeless, and they both care about their kids, and that's really what it's about.
It's an honor to go there every day and see the people giving service. And we have doctors from Stanford and Tufts, and they can choose wherever they want to go. And yet they choose to serve right here in our wonderful county, and we're grateful for that.
Well, Amy Towner, thank you so much.
Oh, thank you, Dr. Landon.
Ventura, it's time for you to support this foundation. There's more information at the end, and all the young women, it's time for you to think about STEM as well.